In this training, we are going to look at accessible features of the built environment, from parking lots with no accessible parking spaces to buildings without accessible signage or an elevator to reach the second floor. These barriers to accessibility have dramatic impacts on people with disabilities. At best, it makes accessing goods or services or participating in community events like a vaccination clinic more difficult. But at worst, barriers in the physical environment can make benefiting or participating in these activities impossible. Information from this training can be a useful resource the next time you are surveying a potential shelter location, setting up a POD site, or even rearranging chairs to set up a stakeholder planning meeting. Community and emergency services are required to be accessible to people with a wide range of disabilities under federal law. With that in mind, we are going to use a community vaccination clinic as our example, an activity in which most communities have recent experience. As you or your organization works to develop or revise community vaccination plans, this module serves as a resource for identifying critical elements of accessibility in the built environment, as well as strategies to promote accessibility and inclusion for people with disabilities and the organizations that serve them. Let's start by getting to the vaccination clinic. Many jurisdictions find it most convenient to use government-owned facilities to host a vaccination clinic. This can be a good thing because many government buildings have been assessed to address accessibility barriers. When possible, choose a newer building to serve as a site for providing emergency services, whether a vaccination clinic, sheltering during extreme weather, or to provide recovery services after a disaster. Buildings constructed or remodeled prior to 1990 may not meet ADA accessibility and design standards. If intended for use, older government buildings should be assessed in advance. If accessibility barriers are identified, plans and resources should already be in place to address those barriers as part of the initial stand-up of that building. First, let's think about community members who come by means other than a personal vehicle, by foot, by wheelchair, or even bus. There should be an accessible path of travel from the nearest bus stop all the way to the vaccination clinic, including sidewalks to and around the facility, curb cuts, safe and accessible crosswalks, and accessible path to the facility entrance. The sidewalk should be free of jagged cracks, debris, grass, and overhanging obstacles such as tree limbs. Passing traffic should be far enough away that it is not dangerous to walk or roll along the sidewalk. The parking lot should include accessible parking spaces, including accessible van parking. To begin your assessment, start at the nearest bus stop and examine the path of travel to the main entrance of the facility, just as though you were attending the clinic to get your vaccine. If there are obstacles along the path, such as jagged or grass-covered sidewalks, designate an alternative accessible path. If tree limbs are blocking the path, trim the trees. If other objects, such as a trash dumpster or maintenance or construction materials, are in the way, move them. If there are not adequate traffic lights or pedestrian crosswalks, assign staff or volunteers to serve as crossing guards to ensure it's safe for those who must cross the street. These strategies may include involvement from community partners or other city, county, or parish departments, depending on roles and responsibilities within your organization or jurisdiction. While parking lots often meet legal minimum standards for the number of accessible parking spaces, this number is usually inadequate for large-scale community events. Site setup plans should include designating additional parking spots, including additional parking spots specifically for accessible vans. Post signage in and around the parking lot, clearly marking off routes to accessible parking spaces, as well as the route to an accessible entrance. As one enters the facility, is there an accessible ramp that allows access for those unable to walk up steps? Does the ramp include railings for support in an incline that's not too steep? Are there curb cuts? Ideally, the doorway and accessible entrance have a covered area designated for passenger offloading. This makes it easier for those being dropped off or picked up to do so safely. Vaccination clinics should be in facilities that have a clearly marked, accessible entrance, automatic doors, and a level threshold along the entrance and over the doorway. These features make it possible for people who use wheelchairs or other mobility devices to access the services inside. Let's consider effective communication strategies. Remember, all types of communication should be accessible or available in different formats. Accessible signage may include entry and exit signs, directions around the site, signs to indicate restrooms, room numbers, and informational posters. The signage around your facility should consider large text and high contrast colors that are easy to read. If personnel are providing verbal directions, that information should be accessible too. Playing videos which show an ASL interpreter and closed captions is one strategy jurisdictions use in vaccination clinics to welcome guests, give directions or instructions, and provide info about risks or contraindications for the vaccine. Before we talk about the layout of the vaccine clinic, let's do a quick check of a few other important accessibility features. Are there accessible restrooms that meet ADA building standards? Is there a separate family changing room that would accompany a person's caregiver or personal attendant? Are the accessible restrooms conveniently located with a clear path of travel and no obstacles? Is the door automatic or does it have an accessible handle and is easy to open? If not, prop the door open or designate clinic personnel to post near the restrooms and provide assistance opening the door when needed. Are the water fountains accessible? If not, provide water to guests in an alternative manner. Set up a table with a cooler of water and plastic cups in an accessible, convenient location. If additional services are available to guests, such as providing masks or hand sanitizer, the location and distribution method of these items should be accessible to people with disabilities as well. Are there hallways that seem to get slimmer as it continues? What about the height of the ceiling? Are there any walkways that are uneven that can cause an issue for people with mobility or vision disabilities? If there are accessibility barriers in some, but not all, areas of a facility, do not use those areas unless modifications are in place to address and remedy the issues. Okay, now let's look at the layout or setup of the vaccination clinic. Generally, the more open the layout of the area, the more room there is for people to navigate and move around. Recognize that features such as sharp corners, closed off spaces, smaller tight rooms, slim pathways, and steps or stairs are barriers to accessibility and make it more difficult, sometimes impossible, for people with disabilities to navigate the facility. Avoid these features when choosing the layout of clinic operations. As well, do not assume that all volunteers or clinic staff will be able to navigate around these barriers. Do not designate staff or volunteer sign-in locations or break rooms in locations that are inaccessible either. Staff and volunteers may also have disabilities. Planning for accessibility benefits not just community members, but those working at the site as well. Pay attention to movable elements like the placement of tables and chairs. If they are too close together, a wheelchair user or person with vision disabilities may not be able to move through the space. And people who use canes and crutches may also struggle to squeeze past these obstacles. It's a good practice to periodically reassess for accessibility throughout the day as people sometimes inadvertently move tables or chairs without meaning to cause barriers for those with mobility disabilities. Is the path from the waiting area to the vaccination station free of obstacles and with clear navigating instructions posted or provided some other way? Can a person with a wheelchair easily navigate around the clinic area so that the healthcare worker can maneuver around to safely administer the vaccine? Are handouts with vaccine safety information provided in accessible and alternative formats? Consider lighting within and around the facility. Proper lighting is essential for everyone's eyesight and the ability to see. This is also important for visual disabilities. Disability organizations in your area can provide suggestions for preferred lighting in the facility for visual enhancement. If one must wait for a set amount of time after receiving the vaccine, is the route from the vaccine clinic area to the waiting room accessible? Is there accessible signage which provides navigational assistance? Is the waiting room set up in a way that it is accessible with clear paths of travel to and from the chairs and entranceways? And finally, what about the path from the post vaccine waiting area to the exit? Is it accessible and clearly marked with accessible signage? Does the exit door open automatically? If not, is the door handle easy to maneuver and can the door be opened without force? If not, assign staff or volunteers to post at the exit and open the doors for individuals as they leave the facility. It's helpful to address your site in its present form and ask yourself, would all guests be able to comfortably move about, access all areas, reach counters, and be able to travel safely by all means around this site? It is helpful to try and view the facility, including the perimeter, layout, and navigational signage, through the eyes of a person with a disability. Even better, invite people with disabilities or disability led organizations to help with making sure your community vaccination clinics are accessible. Hard as we may try, and as well intentioned as we may be, we cannot fully appreciate and apply the lived experiences of those with disabilities when attempting to identify and address all the potential barriers to accessibility and inclusion. It's not only important to consider and plan for accessible facilities and services during public health emergencies or other disasters, but also during your day to day work and in the services or activities your organization provides the community. One's baseline health status impacts if, how, and to what degree a person is impacted by a disaster, as well as the resources or assistance which may be needed for survival or to return to normalcy. For each of us, our baseline health is impacted by our access to healthcare, preventative screenings and vaccines, and engaging in health behaviors like exercising and eating healthy. Aging and Disability Network organizations are invaluable resources for local public health departments, healthcare, or other community organizations working to provide accessible and inclusive services to a diverse population with a range of disabilities and functional limitations. Partnering with these organizations provides a perspective of the lived disability experience that cannot be found elsewhere and assists local jurisdictions in making community health events, like vaccination clinics, as easy and welcoming as possible for older adults and people with disabilities.